Are we on? Perfect. Hi everyone. I'm Sophie and I'm a vet and I run Animal Love Pet First Aid, and tonight I thought I'd just come on. There'll probably be a series of chats like this, this one being the first one tonight, where I'm just going to cover a few little hints and tips of first aid things that you might be able to do at home. As you know, as I always say, I'm not giving you these hints and tips to get rid of your vet. I'm often giving them to you to buy a bit of time, or especially during the times we're facing right now, you might find that your vet actually gets you to do some of these things at home, because a lot of routine things or things that are not deemed as life-threatening or emergency or essential are maybe being delayed a little, or medication is being put up for you. So don't be put off if your vets are saying you can't come in. Sometimes they're doing the consultations via telephone, WhatsApp, and all of those kinds of things. So you won't be on your own. Oh, hello everybody. I can see a few people joining me. That's lovely. Thank you. So I'm not on my own. So I'm going to cover a few little things tonight. As I say, it's just a snippet of things, give you a few ideas of things you could keep in your first aid kit. Some of them you probably already have at home, some of them you might decide to go out and buy, and some of them you might just keep in mind for future if you need them. So I'm going to start off first of all, I'm going to get rid of my name because you all know who I am now. I'm going to start off looking at applying a poultice. So I think first of all, we've got to think about why we apply a poultice, and I'm going to tell you what it is and how I make one. So often I apply poultices to something very simple for you at home would be something like a cut pad. Now, I'm not talking a great big gashed open cut pad where there's bits of pad flapping in the wind. I'm talking about maybe a small cut that you think to yourself, okay, it looks like it might be a bit dirty. I want to draw that dirt out. I want to give it a really, really good clean. So that's one reason why I would say to you a poultice is a good thing. Another reason might be that if you suspect that there may be a grass seed. Now, a poultice isn't necessarily going to be the be all and end all in all of this. And sometimes I say to people, you know, if you're there on Sunday night, 11 o'clock, and your dog's licking its foot, or your cat's licking its foot, bear in mind these things apply to dog and cat, they're licking their foot like mad, and perhaps it's a bit red, and you suspect there might be a little splinter or maybe a bit of grass seed, then you could apply a poultice either overnight or just on for a few hours and then see what it's looking like in the morning. And obviously I don't like you to leave grass seeds too long because they can go wandering. So for those of you that don't know what they look like, this is what a grass seed looks like. I just want you to be familiar, because I say grass seed, and you know, I say it because obviously I deal with it all the time, and it might be that you know exactly what I'm talking about, but if you don't, that's what they look like, and you can notice they're barbed. So that's what makes them a real pain in the neck, because it means that when they go through the skin, that little forked area can sometimes get stuck and make it almost impossible to come back out the entry point that it's gone in. And the common places are places like in between the toes, inside the ear canals, which are often, obviously, as you can imagine, the dog's shaking its head like mad. Under the armpits is often a common one as well. And to try and kind of, I guess, minimise things like them getting stuck in the feet and under their armpit, is maybe like shaving those areas. So if you're familiar with clippers, obviously if you've not used clippers before and you're not, confident, then I don't want you to get into that because you might nick the skin. But if you are, then you can clip the armpit area just to remove the hair, making it less likely for the grass seeds to get stuck and then push their way through. And equally, again, you can clear all the fur inside the foot, so where the pads are and between the toes, and make sure that there's not too much hair there. So I'm talking really spaniels with their really hairy feet. They often need them clearing out. I guess a disadvantage for you right now is that where we're on lockdown, you don't have the benefit of a groomer to help you right now, which would be the ideal. I'm sure all the groomers out there are thinking, oh my goodness, in a few weeks' time we're going to be queuing down the high street for us. I think that might happen. But what I would say is, if you can clear any of the hair out, but only if you can do it safely, then that's the ideal thing to do. So that's the first thing I'd say. And then if you think you've got an area, so when you get a grass seed, sometimes you get something that looks a bit like this, here. So we get a swelling in between the toes. Now, that particular area, I believe I actually saw that in a dog, and it ended up just being a cyst. And often you can see an entry point, it's almost like a little hole where you've seen something go in, which actually even confusing you a little bit. Even with a cyst, sometimes you can see that. But the point being, if you're seeing a swelling like this, you've got to be suspicious that maybe something is in there. So the way I do my poultices, first of all, I like to give the foot a really good wash in, even you could just use lukewarm water, but you can imagine when you have a bath, your skin gets quite soft and supple. So you want to kind of make the skin quite supple, because it's going to make it more likely then that something's going to be drawn out. And then I make my poultice with milk and bread. I mean, the ideal is something called animal lintex. Anyone horsey out there will know exactly what I'm talking about. But these are products you've got in your house. And so therefore, I think, well, if you're in a position, you don't want to be going out spending 20 quid on animal lintex, the possibility of a poultice that that you may never use. So basically, it looks pretty gross, but I've made this up because lots of people say to me, well, how much milk, how much bread, how thick do I make it? So I popped a bit of milk in the microwave for like 20 seconds, and literally probably about enough to fill this part here up to in the cup, so not an awful lot. And then I added half a slice of white bread, and it basically comes in this kind of consistency, so it's a bit gluey. I'm going to regret that now because I won't get that off my hands, but it's a bit gluey and sticky, a bit like dough, but sort of slightly stickier, almost like dough that feels like it needs a bit of extra flour. And you can basically, let's say for argument's sake, we are, yeah, sorry, I just saw that then. I'm a groomer waiting for the rush. Yeah, I know, I'm sorry. I think it's gonna be busy. Us vets are thinking exactly the same. So if we have something like that area in between the toes, we would then apply that horrible looking mixture in between their toes. Take something like a gauze swab like this, normally better than cotton wool, because cotton wool often sticks to things, and you might find that if it's a bit sore it will get stuck. Put that over the top, and then you're going to apply a bandage. Now whenever you bandage a foot, I mean, it's quite tricky. If I've not taught you a course before, you might find that you don't feel confident in applying a bandage, but remember, this has only got to be on really for a couple of hours minimum for you to be able to hopefully make a difference. So even if you can put something simple on, and I always think using something like a bandage like this that I call a conforming bandage, it's nice and elasticated, it stops you putting too much pressure on. And however you do a bandage, you just must make sure that your cat or dog's paw is inside the bandage. So what I mean is that you incorporate their foot, even if, I know you're not going to be poulticing something, high up on the leg, but let's say, for example, you're still going to start from the foot upwards. And that's just because if you're not a confident bandager, there's a risk that you might do it too tight at the bottom and cause swelling and a big swollen fat foot, which would be really sore. And a poultice literally can just stay on for a few hours. I mean, if you've got a dog that won't eat lots of things, which I know lots of people have dogs that do eat lots of things. Oh, I keep nappies if my horse needs poultices. Yeah, I know, I've heard that a lot. But horsey people are quite, without saying it wrong way, quite different, I think, to small animal people, as in they end up doing things in a bit more practical, I guess. I know that from being a sort of horsey person myself, tend to do a lot more things yourself. So basically, even if that poultice just stays on for a couple of hours, then actually there's a good job that it will pull, especially on a bit of a cut pad, you're going to draw all that dirt out, and now you've got a really clean area. And that clean area you can cover with like a poo bag if you're going out for a walk, and just keep it clean for a couple of days while it's healing. But as I said at the beginning, with a poultice, if you think it's a grass seed, I think overnight poulticing, if you give it a squeeze the next day, so a lump like that, say you gave it a bit of a massage, Rosie, nice t-shirt, I know you've got one of these too, and if you give it a massage, like, and you push the area down, almost like you feel like you're milking it out, for want of a better word, but that's kind of how I'd imagine it, pushing down like above that lump as though you're pushing something out, you might get lucky and whatever's in there might pop out for you to grab. I've had it before, I've had it where people have poulticed things overnight for me, and then they've said to me, well, can you please see if it will come out the next day? And I've got lucky, and it has. Obviously, there's other times where you have to go cutting in and looking for it. Well, we have to go in and cutting, looking for it. Don't do that. Imagine you in your kitchen tables. Don't do that. So yeah, absolutely. So a poultice is there. It's one option. It's something very simple. A bit of milk, bit of bread. Everyone's got it, and it can help clean something, cleanse something, even if it's just a small wound, to get out all the dirt. Actually, as well, going back to groomers, quite good for hair splinters. I remember my partner Adam, because when I used to do a lot of dog grooming. I'm a qualified dog groomer, not just sort of made up. Used to do a lot of dog grooming, and he had a hair splinter, a nasty one, that kept forming an abscess between his fingers. We poulticed that. I mean, it was different because, you know, you've got a bit more freedom, I guess, when it's people. I poulticed it several times, and eventually the hair splinter worked its way out, so that was really good. So you can use it for that too. The next thing I was going to go on to is, so I'm just going to give you little simple hints and tips, as I say, and then the next time I come and join you, I'll probably cover something else in a bit more detail. So cold black tea, absolute angel for so many things. You've all got tea bags. Well, I say that, I shouldn't make that assumption. Some people don't like drinking tea, but actually, if you don't drink tea, you find some people end up drinking green tea, and that's just as good. And actually, for this specific area that I'm going to talk about, eyes, you can get something called herbal eye bright tea, which is also really great too. So I do appreciate, let's come off of that picture, that eyes are scary, okay, and I absolutely understand that unless it's something mild, you're not going to want to leave that for too long, and I get that. Just as a quick story, actually tying up with the first bit about grass seeds, I experienced this last year in July when I came downstairs very early, because I've got too many children that are all very early risers. I came down very early in the morning and found my Springer in immense pain. I mean, when people say, I think he might be in pain, this was pain that, you know, you don't have to have any qualifications to recognise. He was in severe pain. I was several feet away from him and he was turning his head to one side. Adam, my partner, and I did debate for a while. He was saying it's his ear and I was saying it was his eye, until I then called the vet card and went, listen to me, it's his eye. And it was his eye. And poor guy had basically, in a period of less than 12 hours, he'd gone blind, he was in immense pain, and he had to have his eye removed, and actually it was a bit of grass seed that had been embedded in his eye. So when I say about how nasty grass seeds can be, yeah, they can do serious damage. So yeah, that was not very nice. But we're talking about mild eye conditions here, and when I say mild, I mean kind of a bit of a red eye, a bit of a pinky red eye that a dog's finding a bit irritated, but he's not there going, I can't open this, because that's a sign of pain. He's not going, oh my goodness, bright light, I need to close it, because that's a sign of pain. And he's not going so mad, scratching, rubbing it, because the worry with that is he might cause himself an ulcer. So as long as it's basically like, this looks a bit sore, yes, I'm a bit squinty, a bit blinky, it's a bit uncomfortable, then I would start getting your cold black tea in. So basically, all I do is make tea and leave it to go cold. It's as simple as that. And sometimes people choose to just actually hold the physical tea bag on their eye, and that's fine. The thing I would say, however you do this, you want plenty of tea getting in the eye. So I don't mean, let's dab that and give it a little wipe. I mean, let's saturate that and squeeze it into their eye. So that's what I mean. I mean, giving it an eye bath. Like if you got some saline and you gave your eye a wash through because it was hurting, although I'd use tea instead of saline, that's what I want you to do, like a flush. Some people do say to me, well, yeah, cold black tea, I use salt water. And I always cringe that little bit, because the thing is, you don't actually know the right amounts of salt to the water that you should be adding. And is it all really getting dissolved? And how much does that sting? I mean, you think about if you have like a little sore in your mouth and you eat something with salt on it, how much that hurts. Can you imagine if your eye's a bit sensitive and you get salt in it? Personally, I think it can be really uncomfortable, and what you want is something to soothe the eye. So tea has tannins, which basically stops it from feeling itchy, I always forget that other word beginning with B that it contains, all completely gone off my mind, but basically two things in it that take down inflammation and stop it from being itchy. So they actually try and help. And as I said earlier, if you get a dog that gets a lot of dry eye and constant problems, then herbal eye bright tea is really great too. If you see, use this for humans too. Yeah, you can use that for humans, a cold black tea. You can use it for rabbits, horses, cats, dogs, anything. It's absolutely, you know, you're not going to cause any harm by doing that. So if you came down in the morning, your dog had a little bit of a sensitive eye, my advice would be bathe lots with cold black tea. So you might bathe it, give him an hour and bathe it again. And it might be that it's, you know, early doors, you've just got out of bed, you know, your vet's perhaps isn't open, or they've got an emergency service, but they're not, you don't feel it's, you know, a dire emergency. Then plenty of cold black tea bathing, even if your vet says to you, yeah, your dog needs eye drops. He needs antibiotic eye drops. It's got a really sore eye. Then actually bathing before you use eye drops is a really good thing to get out any sort of dirt or anything that's in there. You bathe with the cold black tea, you give it about 20 minutes, and then you put your eye drops in so that they don't wash each other out. If you see something like this is something I always say to you, you should always probably get a bit of advice with, and that's obviously this dog's third eyelid. So dogs and cats and many animals actually have 3 eyelids. So the top and the bottom, and that one that comes across at the side there is pigmented. That eyelid there is actually pigmented. That's why it looks a bit pink in the corner and then black at the corner at the sides. And you might know that, but actually as a final year vet student, I remember querying my spaniel, who I still have now. He's coming up 12 this year. He's an old man, but I remember seeing his third eyelid and thinking, what's wrong with his third eyelid? Why has he got this black bit on there? He must have a melanoma. You know, all these kind of weird things going in my head. No, it was just pigment. So it's completely fine if you've worked with dogs and cats for a long time. Yeah, works for gerbils too, the cold black tea. Yeah, brilliant. Yeah, I remember that actually with your gerbil, Helen, not long ago. And yes, it can be pigmented, so don't freak out if you see a black bit on that third eyelid. But the point of the third eyelid is that it's a protective mechanism. So you imagine if they're out in the wild and they got a scratch on their eye, one of the first things that they often do is bring that third eyelid across, because it's like having a bandage. So it's almost saying, I want to protect my eye, I'm sticking this third eyelid across, I need to let it heal underneath. And indeed, what we do sometimes, if we have a dog or a cat or animals with nasty ulcers, sometimes we actually give them an anaesthetic, get that third eyelid and stitch it over the eye and leave it in place for 10 days while it heals underneath. So the third eyelid's great, but what the third eyelid often tells you, if it's up, is that actually it's quite sore under there, and that there's a higher chance that there's maybe an ulcer or maybe something stuck, like a foreign body, so a little piece of something's got in there. So if you see the third eyelid come up, that's more of a concern, telling you actually it's not just a bit of mild conjunctivitis, it's probably more likely to be something, you know, slightly worse. Now, if the dog would tolerate it, or the cat would tolerate it, they're not in loads of pain, you can still give it a bathe if you're awake, because it will still soothe. You imagine what it's like if you've got a sore eye, something nice in it like tea would just take away that discomfort. So you won't be hurting, but it's just to say that's probably more likely to need to see a vet. Then we have this eye. Now, I think you should be able to see that in the corner. This is oh, so should I use tea now? Yeah, John, use tea. It's so much better. Even if you dilute salt water like hugely, tea's still got healing benefits in it. So the salt water might kind of give it a good clean, but the tea will help heal at the same time. So you're getting double whammy. It's like so much better value for money. This dog's eye, you can see right in the corner, it's got a discharge there. It's closing its eye. So for people that like technical terms, this is called blepharospasm. So he's the eyelids are spasming together because it hurts to keep the eye open. And then if we shone a light at that eye, you'd probably want to close it because it'd feel really sensitive. But what I want you to focus on is that area in the corner there that's like green, yucky discharge. And when you see green discharge like that often tells you that it's infectious, and that actually it's more likely they'll need to have antibiotic drops. So those eyes, I would say, again, cold black tea in them, you are not going to cause like any injury, okay? You're not. I mean, obviously the dog's saying, get off me, like my dog when he had his grass seed, there's no way. I could hardly touch him, let alone get anything in his eye. Never going to happen. And that's pain where, you know, something like glaucoma, you know, because they're in so much pain, you can't start bathing it and messing around with it. They won't let you go near it. What if the third eyelid is always there? Okay, so that's quite interesting. That's a really good question. So third eyelid can often just be there in terms of, sometimes it's related like to a nerve. And basically, if you've got some damage to that nerve, I don't mean something really serious, like I don't want you to panic from me saying that, but sometimes it can just make that third eyelid lazy, I guess, for want of a better term. Like if we had a lazy eye, it's kind of makes it a little bit lazy. If you have third eyelids that are really far up, so not just a little bit, but really far up on one eye or on both eyes, like almost sort of, half up, then that's often related to a neurological condition called Horner's syndrome, for throwing out some terms there for you. And if it's a third eyelid up in a cat, it's weird. Cats work a little bit differently. And I always get a little bit more edgy when I see third eyelids up on a cat, especially if it's both of them. Sometimes it can just mean that, for want, again, of a better term, I just feel rubbish. And sometimes that's what they do. They pull their third eyelids up and say, guys, I don't feel great. And often it accompanies something like not eating, a fever, and just feeling generally rough. But if it's just ever so slightly there and you just notice it now and again, or even if it is just there constantly, most of the time that can be said, maybe the nerve's just a bit lazy, and so therefore it never retracts itself all the way back down and in. So I wouldn't panic unless you're noticing other symptoms of that eye. So if you see that discharge, that green discharge, then they often need to have antibiotic drops. So that's often a time you're going to need to go and see a vet. If the discharge is like watery, now I'm going to go with something really specific here, because I'm thinking specifically cats. Cats often get like maybe just the one eye where it's watery kind of discharge, almost like tears, and they're very, very squinty. We sometimes see that with a herpes virus infection, and sometimes it can be like in young kittens, or it can be in cats that maybe have contracted herpes virus when they were really little. When they get things like cat flu and they get unwell, they get these squinty eyes, almost like, they feel, I can imagine it's sort of almost feeling gritty and uncomfortable. No, we don't use necessarily antibiotic drops for those. We do still use drops to just take away the inflammation. So I think anything that's affecting quality of life and making them uncomfortable needs to get some help. So I'm going to move on to, before that, a couple of things I'm going to talk about today. So cold black tea you've got. Now, if you feel like, so some people that have got dogs and cats and things that have got ongoing eye issues, like things like dry eye. So let's say dry eye in a dog, often you need to put lubricating drops in every day to help, because they're basically just not making any tears, and that's fine. That makes absolute sense. Actually, you can get this, going off a side track now, you can get this surgery done where I always think of this because I've never seen a dog have this done, and I'm not quite sure whether I'd like this or not, but you connect the salivary gland to their tear duct, because they're not producing any tears when they have dry eye, and it works brilliantly. But it sounds awful, but when the food's coming out and their saliva's being produced, apparently these dogs' eyes are just crazy amounts of tears, obviously because it's all saliva. So it's great because their eye feels good, but it's not so good for you, probably clearing up pools of saliva. So I am going to just talk to you a bit about colloidal silver. And those of you who have been on courses with me know I'm absolutely a massive fan of colloidal silver. And again, I'm very much the conventional vet, as in, of course, I sign an oath and I have to follow certain guidelines, but I do quite like complementary things that go alongside it. I don't like to use alternative, because I don't often think that there's a time for just one place or another. Often a combination works really nicely, and it's about having options. And if things aren't too serious and stressful at home, and you've got a vet say on a video call saying, yeah, just it's a bit like a bit of mild conjunctivitis, bathe it a few times a day, you can use this stuff. And this is colloidal silver in an eye drop form. So it's just been put into a bottle for you, so it's ready to apply as eye drops. It's quite good for your own, you can use it on your own eyes. Basically, it's not species specific. It's actually made for people, but it's the company that produces this also make it for animals too. So this is a nice silver drop that, again, it's just a soothing thing. Even you could, for argument's sake, you could say if your dog gets constant hay fever and is scratching their eyes, if you keep getting hay fever and you're scratching your eyes, it just feels quite nice to have this in. So this is colloidal silver specifically in a bottle for eyes, because it's developed in that way to make it easier. But silver comes in lots of different forms, and I'll talk to you about those a couple more when we go through the last sort of couple of bits. So I want to move on to ears, and just talk to you a little bit about ears, because I think it's quite useful for you. So this is a really not a particularly nice ear, sort of what I would say looks like a a yeasty ear with that kind of brown wax. It probably smells a bit, sort of things you might see as a dog. And again, cats get yeasty infections like this. You know, all species can get infections in their ears. So I'm not specifically, when I say dog, I don't just mean dog, but they get really, shake their head a lot, scratch their head, push their head up against maybe the furniture, and sometimes they can get so OTT with the scratching, they can produce something called a hematoma, so like a blood blister that forms on their ear, and sometimes they can be really big, and often you can not miss them basically because they can be really large, and they definitely need to be treated. Often, although I'm not a massive steroid lover, steroids actually can work quite well to treat those, but trying to prevent it in the first place and get the ear infection under control is really important. The other time you might see hematomas, again, any dog groomers listening, and I think it's nice to share, even if you're not a dog groomer, to give a shout out to these guys to say that sometimes if an owner brings in a really matted dog, if you're clipping the hair on the ears and it's really thick with mats, sometimes you can get bleeding underneath, and it's almost like little hematomas that are formed because of mats pulling on the ear. I only say that because I like to support the dog groomers out there, because sometimes they get a bit of flack from owners saying, hang on, what have you done? You butchered my dog's ear. No, if you've got a big mat or hair pulling on that area, you might get an injury to the skin underneath and bleeding, and that's not their fault, it's the mat's fault. So yeah, this is not a particularly nice looking ear. Now, how often are you going to clean your ear? Well, this is where some people, I think, go a little bit wrong. So I don't want you to be cleaning the ears every week unless you have a dog or a cat that gets underlying issues, in which case, yes, you want to keep on, under the dirt under control. But in general terms, I wouldn't be saying, yeah, let's just go and clean them every week willy-nilly. If the dog's ears, I would say, if something looks good, just don't touch it. It's a bit like I say to people when they come to me, oh, can you check my dog's anal glands? Well, have they been showing any signs, scooting, licking their bottom? No, just check them. It's not really the sort of things you want to just check. Once you kind of open that can of worms, you're forever at it then. So you kind of want to just keep an eye, but not act too rash. But if you've got an animal that basically keeps getting recurrent ear problems, then keeping on top of that dirt is really important. Now, a couple of ear cleaners that you can just make at home, and they're safe, because I know it's always a worry. If you put something into a dog's ear, especially if it's medicated drops, this is why vets always say to you, I know you had eardrops last month and it cleared it up, and I know it's again, I know you don't want to come along again. It's because often what we're doing is looking to make sure they haven't ruptured their eardrum. Because if they've ruptured their eardrum, if we put medicated eardrops in, they'll develop neurological signs and they can get really sick. So that's why we always check, because all that head shaking might have ruptured it. Just because it wasn't ruptured a month ago, it might be ruptured now. So I know it's really irritating for you guys. It's almost like, I've just been there. Can't you just dispense the same thing again? But often that's why, just to make sure. So there's a couple of things. I've just seen some nice comments on there. Thank you. Oh, and hi Nikki. Oh, that's my sister-in-law's sister. And Chloe, no, good. Yeah, I think we need to, definitely support our professions and just help people to understand, like groomers and things, like how these things happen and why things can look sore when it's not your fault. So apple cider vinegar, I really love apple cider vinegar. And I don't know if you can see, yeah, you can kind of see that bottle there, but on there it actually says with the mother. And good quality apple cider vinegar needs to say with the mother on it. Now, you can't really see this in here, but it's got a load of sediment in it, and that basically means that it's good quality stuff. You don't have to pay a lot of money. I can't remember how much I paid for this big bottle, but it was definitely less than a tenner. It's not expensive, and it lasts a long time. It's got multiple uses, and one of them, it can make a really good ear cleaner. And what I would say is, if a dog's ear looks really red raw, then okay, yeah, vinegar's acidic, and you might say to yourself, oh, I'm not putting that in there, and I totally agree with you. This is kind of more like a preventative to try and stop infections happening in the first place, and then when the ear's starting to get under control, that's another time to use it as well. So I use 1 part apple cider vinegar mixed with 20 parts cooled boiled water, and I mix those two together. So say a ml of apple cider vinegar, 20 ml of cooled boiled water, and that makes yourself a really nice ear cleaner. If you've got a dog that's getting recurrent problems, yes, you might find that you want to get into a certain regime. So one of the regimes I quite like, what would the signs be if a dog had a ruptured eardrum? So they would be things like, I'll go back to that in a sec, but there'd be things like a head tilt. So they would be keeping their head maybe to one side. They might vomit because they might feel dizzy. They might look uncoordinated when they're walking. Very extreme cases might, end up with a dog having a fit or something like that. But in general terms, it's things like head tilts, feeling dizzy. I guess that feeling if you've ever had vertigo, so you just feel really unsteady. And that's quite often a sign that you can see. And we do see other signs develop, but that's normally what you'll see at home in the beginning. But yeah, that's a good question. And they'll be acting very differently and be really uncoordinated. So you could clean with your apple cider vinegar. And the other thing I really like, I'm going back to silver again. And again, silver, you can get it in just a general bottle, which is just general use in eyes, in ears, on skin, orally, believe it or not. You can use it for lots of different things. Or you can get it in a dropper bottle, which basically therefore means it's good to go. It's good to put into the ear. So the way that I tend to do it is to use a syringe, because I think that's probably the easiest way. I know you don't want to go putting loads of stuff into your dog's ear canal, and I totally get that. And if you're anxious about something, it's a new infection, then yeah, you need to get it checked out. But if you find you're going through the same process week after week and month after month, the dog keeps going back, it's recurrent ear infections, we've had swabs done, this might actually help with trying to keep the infections at bay. So I do 1 week where I clean with the diluted apple cider vinegar. So say, make that up, put a little bit into your syringe, drop that into their ear canal. I find normally holding the flap of the ear up, whether it's dog or cat, and popping it inside their ear, and then giving it a good old rub around like you would a normal dog ear cleaner or cat ear cleaner. Works the same way. And then I find doing that 1 week and then switching to colloidal silver the next seems to work in a really nice combo. Now, this is something I made up actually about 2 years ago, when I literally dealt with a client's dog that was just getting ridiculous. It was like ear infection after ear infection, constant steroids, constant Apoquel, blah, 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 just doing things all the time, and said, well, why don't we just try this combo? Because both these things are quite nice to put into the ear. We've got nothing to lose. And she ended up doing really well. And basically the number of ear infections went down considerably, with barely having any at all. And we moved it to further and further apart. So we'd then do maybe every 2 weeks with the apple cider vinegar, then every 2 weeks with this. So, week 2 with the vinegar, week 4 with the silver, week 6 with the vinegar, week 8 with the silver, and so on and so on. And that can work as a really nice combo. If you can, the further apart you can spread that out. So even if you just end up with dogs' ears that have these recurrent infections, but you've got it under control, and you just do like every 3 weeks or every 4 weeks, then great. The more you put things into a dog or cat's ears, the more wax they produce. It's just a natural thing. And obviously as well, you're putting moisture into the ear, which can often then harbour bacteria. So you just don't want to do it too much. It's great when it's almost that little and often thing works really well, but they're actually really nice products that you can use and help soothe that area. And I wanted to, so that's really with ears. I just want you to kind of be vigilant, smell them. I know it sounds gross. I smell everything when it comes into practice with me. I think it tells you quite a lot. I think it tells you quite a lot. Yes, so, actually, I've probably got a few, your dogs live on Apoquel. Yeah, Apoquel is really helpful. And I know, it's horrible, because I know lots of people will be on here and say, I hate that drug, it's immunosuppressing. But the thing is, it's a bit like antibiotics, steroids, Apoquel, all these things, they definitely have their time and place. And if you've tried all other options and exhausted all other options, sometimes it's about quality of life and not quantity, and as in, we need to keep them happy and healthy and feeling good. And if that means using a drug that we don't really like, but it means that they get 10 years of good life instead of 10 years of feeling uncomfortable all the time, then I think that's the best way to be. And how much do you put in? That's a good question, Karen. So I would say really, so I've got a 5 ml syringe here. I would probably just put somewhere between sort of about 1/2 ml. So that would just be a good, equivalent to a good few drops. So about 1/2 ml would do fine. And then with the silver drops, if you had like a dropper bottle, you could just put sort of 3 or 4 drops in. Or if you had, again, the plain bottle, you could just put, again, 1/2 ml in of that. But it works out to be quite a nice combination. Okay, then I want to talk to you a little bit about wounds. Now, I'm gonna talk about grazes and hotspots and all the things that maybe you might be encouraged, especially right now, to try and help at home. Back in the day, I make myself sound old now, but you know, when I started out as a vet, 11 years ago, I remember we all loved Sudocrem. And there'll be a few of you that might say, oh, I still use that now. But you know, about a couple of years ago, there was this connection made that probably should have been made a long time before. And actually, I just hope nobody else is recommending Sudocrem at this time. But basically, Sudocrem contains zinc, and zinc is toxic to dogs. So we shouldn't be using it, especially in areas that they can lick. And we need to be careful because zinc toxicity, although it's argument, like there's an argument behind this. So basically, they either have to ingest a lot or they have to ingest it frequently. So you could argue and say, oh yeah, I'm just going to put a bit of Sudocrem 2 or 3 times a day on my dog's wound. The thing is, if they're licking at that, they are ingesting it frequently. And it could be that you just get signs like an upset tummy, vomiting and diarrhea, but there have been deaths of zinc toxicity related to Sudocrem, and using it on those kinds of areas, I believe very few. So don't start panicking if you're like, oh, I've used it frequently. Oh, but what I'd say is I'll just use something safer. And I don't like it because where it's a barrier cream, it doesn't let anything breathe underneath. It's very thick, it's very dense. Sometimes people just smudge it on in a massive old wodge. You know, you get dogs with skin fold infections, smear it all in, all gets a bit sort of, you know, oh, I don't, you know, I'm sorry to use the word moist if anyone hates it, but it does, and it harbours bacteria and it makes it worse. So I'd say you want light creams. You want to stick to something that definitely doesn't have zinc in it. So a lot of human creams do. That's why we say don't use them. So with wounds, the first thing that's really important is you've got to stop them licking it. And so you really should somehow, somewhere have some sort of way of doing that. This is probably the most painful way for them in terms of many, you know, dogs or cats like buster collars, and I completely get that because it must feel very, very odd having something around your head like this. Or the only sort of going sidetrack here, the one ingenious thing I did see was someone that got a buster collar, stuck like those like little drain rod things, those little like wire, piece of wire off it, and placed it onto a dog that was blind. And so therefore, every time he walked, he had these kind of little wire bits at the side that basically showed him that he was getting too close to a wall or hitting something. Really cute thing to do, and it worked so well. It made this dog have a great quality of life because it's almost like having a little white stick. He knew where he was going. So yeah, so basically I want you to stop him licking it, and sometimes it might be that you use a collar like this or a comfy collar, so the ones that you blow up. You could use a t-shirt, and sometimes that's or a baby grow if you've got a small cat or dog. The only problem is, like you probably know, it's quite nice to get air to things, and this is why I always say that if there's wounds, I'm not a massive fan of bandaging things or cover things up. Sometimes it's the only thing you can do because you need to stop them licking it. Lots of bacteria in their mouth, and at high risk that they might induce an infection in that area, which is why when they have a surgery, we say don't let them lick it. So that was always a really good thing to do. And then if you have something like this, this is quite a common thing. This is a hotspot. So this dog has been licking at that area, making it incredibly sore. And he might have done it for many, many reasons. There's a multitude of reasons there. And sometimes you've got to think about the underlying cause. Is it because he's an elderly dog, he's got a bad back, and he started biting and scratching at one spot and he's just got really obsessed because he's got pain? So is it pain that he's feeling and that's why he's licking it? Is it because he's been stung by a wasp or a bee and it's started off really irritating and now he's made it even worse because he's licked and licked and licked at it, like, you know, self-perpetuating thing? Is it because it's going near the base of his back? So is it that his anal glands need doing? Is it because he's got fleas? Fleas like to feed around the back area and around their tail. Or is it because he's got worms? It's another reason why they can chew around that area. So there's loads of options, you know, a whole load. But it could just be really simple that actually he has just had a little insect bite and he started licking it. You can see all that horrible, cruddy, disgusting fur all around that area, bits of fur sticking in the wound. You want to get rid of all of that. So again, if you're confident with a pair of clippers, I want you to get that hair away. I want you to clip and clear that hair away. If that was me and I was seeing that dog as a vet, I'd be clipping a big patch, probably about twice the size of that wound. So clearing it out so it can't get in and cause irritation. So that'd be the first thing I want to do. Then I would want to bathe it, and I'll go good old cold black tea again. You can't knock it. you can bathe wounds with cold black tea. It's a really nice thing to do. Again, I mean, yes, you can use saline. Again, I'm steering away from salt water, so it can be a bit irritant. But cold black tea is great because, again, it has healing properties. Perfect. So that's one thing that you can do. Stop them licking at it, and then you have got a few things that you can apply. Now, I know that if it's really nasty, you might need antibiotics. And again, your vet might say to you, no, you need this treatment, but there's something you can keep in your first aid kit. Either it's a case that you send a picture through or you speak to your vet, especially during these times, they might say, yeah, go ahead and use it, good idea. And that's this stuff, Activon. Those of you, again, that have been on courses of mine will know I love this stuff. Medical grade Manuka honey, it's not prescription or anything like that. It is basically honey in a tube, but it's got a few things that basically preserve it and prevent any bacteria. I mean, honey can't really grow bacteria, but this is just that bit better. And this is a nice dressing and it can go on any wound. And again, if you've got something nasty, of course you're going to go and get help with it. So it's not to bypass your vet, but it's just for you to have something there that if you've got a simple hotspot, they're scratching at, they're biting at, or it might be you've just noticed it, it's just started. So you could do these things straight away, get rid of the hair, give it a little bathe with some cold black tea, get some Manuka honey on it. So that's a really good thing to use. Again, with bathing, go back to my cold black tea, my colloidal silver once again. And the good thing about these is if you can't touch it and you find they're getting very irritated by having it touched, then you can just use a spray bottle on a bottle like this and just spray the area. Simply just do that and get something on it so it can start helping. Quite like this product too. This is called Magic Gel Spray. So I have a Magic Gel cream, but this is quite nice and spray because again, you know, you can do it from afar and you can just get it on and just basically just help soothe the area. Even if it's just a simple little graze or something, it's just so you've got something that you know you can use to try and help it if you're waiting for an appointment or you can't get one for some time. So that's quite useful to have. And then you might have something like, oh, what about Hibby Scrub? Great question. Oh gosh, there's no other vets on here or nurses. I don't like it. I am not a massive fan, purely because when you scrub your hands with it, when you're working as a vet, it's so drying. And don't get me wrong, it's quite good for fungal infections. So there are times where you get, so you might have heard this fungus called malassezia, and often it causes dogs to have really itchy feet. They bite at them, they get really cross at them, and they get really yeasty and they smell yeasty. And you might find that dogs that get those kind of yeasty infections, that's when it's given to you, because it's a little bit like a shampoo called Malaseb. It works in a very sort of similar way. It's got this chlorhexidine in it, which is quite good for those kinds of infections. There's a time and a place for it. For me, it wouldn't be now, because if it was broken skin or sore skin, actually it stings quite a bit. So actually I find that I try to use things again that are mild, that they're still going to have a job, but they're not going to be stingy and uncomfortable. So I tend to avoid Hibby Scrub unless I've got a real valid reason for using it. But that's my choice. You might be sat there thinking, I use it for everything, my horses, my kids, that's fine. I'm just sort of telling you my experiences and what I find works a bit better. And then you can get a little wound a bit like this. So that, you know, something that's just a bit like a graze. And it might just be that they've grazed themselves and they've gone out and they've run, they've hurt themselves. What I'm trying to say, if it's something quite innocent or, and again, I'm not saying that this is because of your dog groomer or anything like that, but clipper rash, you know, clipper rash can happen for a multitude of reasons. Actually, you probably get more clipper rash when your dog's legs or neck is clipped for a blood sample, than the groomers, who obviously, you know, use clippers all the time and are a lot more experienced with them. And actually, because of that, even though I'm a groomer and, you know, clipping comes fine to me, but even when I'm working in the veterinary world, if I clip anything for blood sample or clip some hair away, I'll always put on it after arnica cream. You can't go wrong with it, because it again will help with sort of soothing the area, so it will help with inflammation, and it will help stop bruising as well. It's like got a multiple pronged effect, I guess. So for a graze like that, yeah, Kelly. Oh, hi, Kelly. Hi. Kelly's a nurse. Not sound really cocky then, like Kelly's a nurse. It does. Yeah, you're right, Kelly. It makes your hand really, really sore. And your vet always gives you Hibby Scrub for paws all the time. I guess if they think it's really fungal infected, then that might be a reason why. is hard without kind of seeing it, whether, you know, but if you don't think it's making a difference, then maybe you could try something else. And actually sometimes with fungal infections, as long as they're not raw, I quite like the apple cider vinegar again, quite like to dilute it down. You can play with dilutions, but I always say start lower and then, you know, with sort of more water. Apple cider vinegar I really got into, and I got really into because actually my partner Adam has sebaceous dermatitis, and it's you know, it can be really sore and uncomfortable for him, and actually this is his bottle of apple cider vinegar. He washes his face in it, but neat. But obviously when you're putting it on animals, you want to make sure it doesn't sting, so you want to start off with diluting it first. Hi Kelly, I haven't seen you in ages. So arnica I really like, and it can really help, and can help us sort of help with healing. And again, you're not going to hurt anybody by doing this. This is the whole point of these first aid tips. You won't make the situation worse. You might buy yourself a little bit of extra time, and it's great if your vet's on the other end and say, well actually, you know, you've just seen that, I've got this and this. And oh, okay, well, you could try that, especially right now when, you know, a graze like this is not going to be top of their priority, as awful as that sounds, but it will be a case of, can we help you help them at home? And if you don't have some things to help them with, it makes it harder. So yeah, arnica cream I really, really do like. Other things that I quite like for wounds, what was I thinking of? Oh yes, even if you think an area looks a bit inflamed and sore as well, there's nothing wrong with putting something a bit cold on there just to help it feel a bit better. And even if you use something, you know, if you ever use something like an instant ice pack, so these obviously don't need to be frozen, you just crush them and they're good to go. Normally a lot of dog walkers use those in case they need them as an emergency, like an adder bite. And I'll talk to you that'll be the last thing I'll cover are bites. I like to wrap it in a towel, because you can imagine sometimes if you've got pure sort of ice hitting your skin, but again, frozen peas from your freezer is fine. If that's going straight on your skin, it could be too much. So just put some thin cloth or something over the top of it, and that can be something as well that can help to soothe an area if you don't think it's sort of open and raw and really, really sore. But even the skin around it, if it feels hot, you know, wounds get inflamed, and the whole process perpetuates each other. The licking, the inflammation, it's your job to try and control that before it gets a big thing, because when it gets a big thing, it means you've got to have antibiotics, steroids, steroid creams, blah, 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 you know, appointments and trips to the vet, etc., pain for the dog or the cat. So that's why you want to nip it in the bud. Okay, I'm going to end with bites and stings, because it's quite prominent right now, because obviously we're at that time of year where we're getting lots of bees, wasps, adders as well. Yes, of course, Chloe, you can absolutely share my video on your page. You're very welcome to, absolutely. Oh, and yes, yeah, try the apple cider vinegar, Lucy. Good idea, because you listen, look, you're not going to hurt, not retracting away from anybody else's advice, but if you're doing something day in, day out, like bathing paws with Hibby Scrub and having no joy, try your regime, try something different. You could even do a combo, again, like you do with the ears, combo with apple cider vinegar, and then use colloidal silver. And then Christine, yeah, I know your poor Jack, I know he gets really, you've persevered, you've probably gone through everything, I know, and tried everything. You use Hibby Scrub and Malaseb on Jack, his paws are really bad, and yeah, I totally agree. I think with Jack, you just got to use whatever combo works for him, and sometimes you've got to go for that stronger stuff because you've just got no other option. I just think also as well, in his situation, it's quite nice to keep those areas, because it is quite drying. Sometimes it's quite nice to put something, even like a drop of, you know, a bit of coconut oil, which again you can use on hotspots. Just rub a bit of coconut oil maybe into the areas that get really dry, or just, you know, or the magic silver gel. I think you've tried that before, but anything that you can just get in, just give it, you know, something a bit else if it's getting a bit too dry. So, oh yes, so Vaseline, that's the only other one thing, because I got a question about this the other day. Vaseline on dry noses, just as a side thing here, but I was thinking about Sudocrem. There have been some, not toxicities, that's the wrong thing, but definitely bouts of diarrhea, and nasty bouts of diarrhea linked with dogs having Vaseline on their nose and licking it off. So I was just going to say, if you've got a dog with a crusty nose that keeps getting problems there, you're better off to look for a proper like nose and paw balm or something like that, like something a bit nicer. Okay, so I'm going to move on to the bites and stings. Bee stings. What I normally do is a certain regime. So bee stings come with a stinger. Stinger is hanging out the skin. As soon as you get a pair of tweezers and pull that stinger out, I mean, you know, word on the street is you look for the stinger, you look for the sac, you put your tweezers underneath the sac. I mean, that's just hideous, because a lot of the time, dog's not going to stay still. You've got to have really good eyesight, you know, and you've got to try and find that sac, because what I'm trying to say is, if you squeeze anywhere around that with your pair of tweezers, you're going to release all the toxin from that bee's venom into your dog or your cat or your rabbit or your horse or whatever it is that you're dealing with, or yourself. Make it 10 times worse. You've already caused, you know, potential anaphylaxis by pushing that, releasing all the venom, and now they're going to have a massive load, a massive histamine release, okay, and that can make the whole thing a gazillion times worse. So the rest, oh, Colette, oh, hi Colette. She's lovely. She's a little girl that always comes and watches on the Thursdays Sophie's Vet School for children, and she's lovely. Thank you for getting out of bed to see me. Okay, so with a bee sting, what I normally say is the best thing is to get something like a debit or a credit card, or this is just, I've got this because this is one of my bee and wasp sting key fobs that I have, giving you the instructions of what to do if you get a bee or a wasp sting. And you can use this a bit like a credit or debit card in terms of, here's your stinger hanging out the skin. I want you to get your credit or your debit card, put it close to the skin and swipe it out. It's the best way, because then you're not squeezing anything and causing anything to be released and making the situation worse and more painful. Now the thing is, wasps don't tend to leave a stinger behind, and they often tend to sting more than once. So I always think, if you're not sure which one it is, if you don't see a stinger, it's more likely to be a wasp sting. Because what you do next is kind of dependent on what they've been stung with. And I always think, if you're not 100% sure, then you can just miss out the first part. But if you're not, again, you're not going to make things worse, okay? You're going to help soothe the pain. So bee sting, and again, here's one I made earlier, but I'll put a bit more water in it, because people always ask me this, and I'm probably going to I'll probably put too much in now. Bicarbonate of soda and a bit of water. And what I did, I made this into a nice paste earlier. I put too much water in now, but what I wanted was a nice kind of like creamy paste that you can rub onto the skin like you would a cream. So that would be for bees. Now just remember, B for bees, bee bicarbonate. So bicarbonate of soda, that's what we call it, alkali, because bee stings are acidic. So they've got acidy kind of feel when they go into the skin. The bicarbonate will neutralise that and stop it from hurting. So if you've got a bee sting, you want bicarbonate of soda, a little bit mixed with water, and then rub that onto the skin, and maybe, make it into a paste. I haven't done the best job there, to add a bit more water to it. You don't actually need an awful lot of water in it. So that's your bee stings. Your wasp stings, here goes your apple cider vinegar again. So apple cider vinegar, good for rashes on the skin, like even things like stinging nettles can sometimes feel a bit better with some diluted apple cider vinegar. You got your washing of your ears, and now you can use it as well for your wasp stings, because it's acidic and you want something acidic on wasp stings. So this will do just fine. It can be any vinegar. It doesn't have to be apple cider vinegar. So don't panic. If you don't got it and suddenly tomorrow your cat gets stung by a wasp, you haven't got to start like panicking because you haven't got this. You can use any vinegar, and that will basically neutralise that sting, because that sting is alkali, and make it feel better. Okay. Then, yes, Claire, of course you can share it on your page. I think if it helps anybody, just for a few little tips, then I'm very happy for you to share it. Anyone, if I help 10 people tonight gain a little bit of extra knowledge, then great. That's all it's about. Just want the animals to feel happy and healthy. So again, going back to my ice pack again, which I've just got in the towel, and again, you just use frozen peas. It hasn't got to be exciting or elaborate, but again, if you're a dog walker, most people, or lots of dog walkers, will carry this there's multiple reasons actually. Again, as I go through weeks, I'll probably teach you all different kinds of things, and ice packs will come back into it again, because they have got multi-use. So again, you can put something cold on the area. If you've not got an ice pack to hand or nothing, or you're out on a walk, if you've got a bottle of water and it's fairly cool, just pour that on it. You just want to get the inflammation down. These are inflammatory, they're angry, they're inflammatory areas. You need to get the heat out and the inflammation out straight away. By doing this quickly, you might prevent a major reaction. So you've basically got your stinger out, you put your vinegar or your bicarb on, depending on what it is, and now you're going to cool it down either with some bottled water or an ice pack wrapped in a towel, because I don't want it to be too cold. Okay, now at that point, it might be that you sit there, oh, there's this poor little guy here. you know, looking at this dog here, he's had a really nasty reaction to a sting, and all his muzzle has come up and his eyes, and it probably feels really, really uncomfortable. And I totally get that sometimes this happens, like this guy here, all his face is swollen up. And then going back to this guy, obviously you can see he's what we call a brachiocephalic dog. So he has a flatter face. And so therefore any swelling around his nose or his throat area could make it difficult for him to breathe. So it's very dependent on where they've got stung as to the sort of reactions you might see. And again, for this guy as well, it's around his face. So, you know, again, if you know basic clinical exam, even if it's during these times and you phone your vet and say, listen, look, my dog's been, you know, stung by a bee, or my cat's been stung by a bee, here's his respiration rate, here's his heart rate. Again, so you know, got a few of those things on my timeline actually, of how to do a heart rate and a respiratory rate. And then you can describe the breathing. Is it abdominal breathing, which means I'm sucking in my tummy muscles and finding it really hard to breathe? That means I am really struggling to breathe. If those are the sort of things you're seeing, they're having a nasty reaction. And actually, your simple things you do at home might not be enough. But there's more you can do if you feel like I've got stung on my leg. Okay, so what's the chances of that causing immense pain? Unlikely. So therefore, you've done your bicarb, your vinegar, your cold compress, which is perfect. Now, some of you out there might think, you know, some of these kind of homeopathic remedies or different kinds of remedies are a bit hocus pocus, and that's fine. I'm not here to make you believe differently. I'm not here to tell you differently. But the one thing I do like, I'm going back to arnica again, because although yes, okay, you know, I don't actually do anything homeopathic in my work, but the one thing that we do know that has a little bit of use and some science behind it is arnica, and that can help improve healing and also take down inflammation. So these guys, stung by a wasp, stung by a bee, you can immediately get some drops of arnica in, and you can repeat that several times. These can go into multi-species again, and the thing is, you're not going to hurt anyone. You're not going to stop any medication working if they need to take steroids or anything else. You're not going to do that. So don't panic by, you know, it's just there as an extra. It's almost like your natural painkiller in your first aid kit for mild conditions, because you've got to travel to the vets and you want them to be comfortable, or because actually your vet said, oh, give it another hour, something along those lines. You know, it's not going to be the cure, but it will likely help and give you a bit of help. So that's really quite nice to use. And then again, on those same areas, you can put arnica cream, because that will be soothing. Anything that you think is soothing and cooling, you know, again, if you've got like things like I say, like I quite like this silver magic gel, you can spray that several times, keep it cool and keep it comfortable. The only last bit I want to cover is about snake bites. Yeah, see, look, Kelly's a nurse and she loves arnica. We use it, you know, we do use it quite a bit in practice. It's great, and it does have some science behind it. And yeah, okay, you know, sometimes I'm not going to say to you, oh, your dog's broken its leg, here you go, take it home with some arnica. But what I might say to you is, right, your dog's had surgery today, it's going home with its Metacam and its Tramadol and, you know, whatever else we're going to do, warm and cold compresses, blah, 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 blah. Actually, you've got any arnica at home, might just help with a bit of inflammation and, you know, helping with the inflammation and healing. So there's, you know, it's there, and I often talk to owners about that as potential extra. So the only other bite you might come across, and this might be where you, how to use arnica drops on a sting. Straight in their mouth. Arnica is oral. Sorry, I should have explained that. So the arnica drops are going to go straight into their mouth. And that's going to work to basically help with inflammation orally, so not on the actual skin itself. For that you would need the cream. A couple of good questions in there actually. So what about a sting in the mouth? Yeah, no, that is such a good question, because the trouble is it can go one or two ways. I think you'll probably have noticed, and you may well know this yourself, that you've maybe never seen any problems with it. And sometimes you get a lot of swelling, and unfortunately, sometimes that does mean that they're going to need to maybe have a bit of steroid. Now, I'm surprised somebody hasn't asked me a question on here. Oh, would you avoid on the face area? Do you mean the arnica cream? Because I don't, that's fine. It's okay to go on, you know, the arnica that we use, generally if they lick any of it, we're okay. So no, you're fine to do that, and you're fine to use the bicarb and the apple cider vinegar. Obviously, if it's very close to the eyes, then that's a different story. You know, if you think it's really going to get in the eye, then absolutely you might find you want to avoid that. And I did have quite a a question that I thought might have come up actually, and just something I want to mention, that sometimes people really want to get into using antihistamines. The thing with antihistamines is there's only certain ones you can use for dogs and cats. And did you know that if you've got a dog or a cat that's prone to fits, had them in the past, has epilepsy, maybe you don't even know they've got epilepsy, because some animals don't show it very clearly. They have their little secret fits here and there, but barely any. Some antihistamines can actually lower what's called the seizure threshold and cause the animal to have a fit. So that's why I say, it's not, again, sometimes you feel like a bit of a job's worth when you're working in the vet industry. You're sort of saying, well, we kind of need to talk to you about it. And it's only because, let's say, for example, that Fluffy had some weird episode 8 years ago, okay, and we're 8 years on, and you've forgotten because it was so small and short, but it's on my clinical notes and it will flag up going, Fluffy had a weird episode. I would then likely say to you on the phone, right, okay, I want you to avoid this antihistamine, or actually I'm going to give him steroids because I think it's too high a risk. So what I'm saying is there are risks involved. If you've used them before and you're au fait with it and you're fine, that's fine. And also it takes 10 seconds to ring your vet and just double check that it's okay. And a lot of them will just say to you, yeah, okay, no, that's fine, I can see on here, I've used it before, blah, blah, blah. It's just worth 10 seconds because you might just cause more damage than what it's worth. Does arnica work with arthritis? And that is such a good question. So arnica is, I always think arnica acute. So if you've got acute pain, acute injury, acute inflammation, I quite like getting the arnica drops in. For longer term, I like sort of green lip mussels and turmerics and things like that. Again, depends on the dog or the cat. I like a whole other combination of things. It's not to say that if they've gone out, they're arthritic and they've come back with a bit of a limp, yeah, absolutely, you can use it. Of course you can. So you could use it, but it's more like a short term, of days to maybe a week, rather than an absolute everyday constant thing that you give for arthritis. So I hope that kind of explains that. So the last bit was about adderbites. And all I really want to say is similar things can apply again, as in, if you've obviously seen your dog or your cat bitten by a snake, then I know completely that you're going to go and get help, because we don't know which way that's going to go. But let's just get in our minds here that less than 5% are really serious. So you've got, over 95% chance that this isn't going to end in death, okay? This isn't going to be massively serious. So that's good for you to remember, because I want you to stay calm, because getting stressed is the worst thing you can do, because when you get stressed, your animal's blood pressure goes up and all that lovely toxin that the adder's just injected into your animal gets pumped around really quickly. So you've actually just made the situation worse just by being stressed. The other thing is, you need to try and minimise movement after they've been bitten. So either you carry them back to your car, obviously if that's a cat or a small dog, that's fine, or if it's a large dog, then you might find you want to take just 10 minutes or 5 to 10 minutes and just sit still for a minute. Because basically the toxin, if you can imagine, someone's just injected you with something, if you start running, your blood's going to pump and it's going to get round really quickly and be a massive shock to the system. If you're slow and you sit down, it will go round slowly. You've got less chance of a big anaphylactic reaction, so a big reaction where you might, drop down and have a fit or have a heart attack or something like that. So keeping them still is really, really key. Yeah, Kimberly, actually, no, it's not wrong that animals can't have Piriton. So I was just going back to this, which is an antihistamine, absolutely. It's just that some animals react badly to it. That's why I would say it's just best just to double check. But if they've had Piriton all their life, like, they've had wasp and bee stings or itchy skin, then the chances of having a reaction is pretty much zero. But if it's a new thing, a new case, especially if it's not your animal, then obviously definitely you want to speak to the owner and speak to their vets. But if it's a new case, just double check. Sometimes you can make the situation worse. I say most of the time you can have those conversations over the phone, or these television vet things that happen right now. You can have those as quite simple conversations. So adderbite, you're going to keep your pet as still as possible for a little while, just while the toxin disperses itself. There's nothing you can do about that toxin. Can't do some Crocodile Dundee trick and start sucking the poison out. It doesn't work. Not going to happen. And I don't want you to tie something really tight around it, so a tourniquet. I don't want you to get something tight so that the blood can't travel, because all you're going to do is potentially end up with a really poorly leg, because you've now stopped the blood flow. So I don't want you to do that. I just want you to keep them calm, keep yourself calm, and then if you've got a little walk back to the car, try and do it steadily. Obviously, if the dog drops to the floor or the cat drops to the floor and it's all very, very shocking, then you're going to do it, you're going to run. But if, it's happened, you've seen it, we're all going to stay calm. Then when you get back to your car, or if it was in your garden for argument's sake, forbid, I'm not a great fan of snakes, that freak me out, then what you can do is, if you've got something like, even like, your silver or something, even an alcohol swab, like ones you get in first aid kits, give it a little clean and a rub around with that. Even cooled bottled water will do it. You just want to get it dirty. Okay, those bites are like any animal bite, they get infected. So even if your animal doesn't have a reaction to the snake bite, the bottom line is it's an animal bite. They're going to need antibiotics and some painkiller. So even if you say to yourself, oh, we got bitten 4 hours ago, he's absolutely fine. By the way, some bites can be delayed. You have delayed reactions. They're still going to need to have treatment because they're still going to get infected. So they're going to have to be seen either way. But it doesn't mean it's going to necessarily be, masses of stress at the hospital that you take them to. It could just be, we'll monitor him here for a couple of hours, giving him some antibiotic, giving him a bit of painkiller. Now he's going to go home. So you're going to keep it nice and cool, keep something cool on it because it's inflammatory, it's sore. Give it kind of a little clean, but not too much vigorous rubbing. Literally just, pour something over it, some saline, anything like that, alcohol wipe just to wipe it. And then you're going to have to get them to the vets either way because we don't know how they're going to react, but chances are it will be a fine reaction and you won't have to go through any stress. So the only other thing I was going to say, I just sidetracked myself then of what I was about to say. Yes, so they were, lots of adder bites, I think, are never noticed. You don't see them. And sometimes, a few days later you come in and you normally say to me, my dog or my cat's got this wound on its back and it's a bit like an abscess. And I go looking and go, oh, look, there's 2 little pincer marks there. So what I'm saying is sometimes it's a delayed reaction and you get a nasty infection like a few days down the line. Now, a couple of questions. So I got just one here, which is fine because I've gone over all the stuff I wanted to get through with you today. Can I say it's a good idea to have a few bits in your first aid kit? You don't have to make them expensive. Cold black tea costs barely anything. Apple cider vinegar costs barely anything. Those of you that follow me anyway know I have an online shop and I always can post out silver or arnica or whatever bits to you if you need to top up. And again, they're not expensive items to have. And you also probably know from me that most of the stuff I have, like silver and things, don't have a shelf life, which I really like. So I think if you pay for something, you don't want to be chucking it away in a year. Now that's a good question. Can you give dogs turmeric caps? Because I know obviously you haven't, I said about turmeric earlier. Now, turmeric, and I found this out from an amazing vet called Shelley, and Shelley is a veterinary herbalist. And she always treats me to little snippets of knowledge that I find incredibly useful. That's why I like to mix with all sorts of different people, different pet professionals. I learn a lot, never stop learning. So the only problem with turmeric is it acts as a blood thinner. And if you have it in higher doses, you can have excessive bleeding. So yes, animals can have turmeric and it can help with inflammatory conditions. The only problem is if they have an underlying clotting disorder, normally you know about that. By the time they've become older and they need something like turmeric, they've had some sort of surgery and we'll know if they've got a problem because they tend to bleed heavy. If they haven't got a clotting disorder, then yes, we normally find that turmeric is absolutely fine to give, but it's just checking those things out. It's only a herb, but it's quite a strong one. Lots of lovely people saying thank you. You are very welcome. It's nice just to come on and just give you some snippets of information, and I'm probably going to look again another couple of weeks to put another little thing like this together. I might do something a little bit more specific next time on like a specific area of the body, something like that. That's a good question. Would you advise keeping a first aid kit in the car as well as the house rather than having to always remember to take one with you? Yeah, that's a good question. I think you'd maybe just want a few essential items, and I know, Kelly, that you've done my you're welcome. Thanks for sharing your knowledge. You're very welcome. Kelly, the answer to your question is there's a couple of things that you might say you want to take, even if it's as simple as like your first aid kit at home might be a little bit more, have more in it. The one that you take out with you may even be as simple as I'm taking a bandage because if there's a wound I want to cover or there's a bleed, I've got something to stick on it. That might be the first thing you want to take. And probably the only other thing, especially if you're a dog walker or if you've got an epileptic animal, and those again that have done courses with me will know that an ice pack's really useful. And again, an ice pack's useful anyway because you can put it on areas like bee stings, wasp stings, adder bites. So you've got something there, and obviously it can sit in the car and you can just break it and use it whenever you need it. So I think you don't need to take a huge amount with you in your car, but it's probably a good idea just to have a couple of basics that you know you've got there just in case. I think that's quite useful. Lots of thanks coming through, and that's really kind because it's really kind of you to thank me for doing this. So I do like to give a little bit of time and just help you with a few tips. And as I say, you know, of course, you know, you've always got the vets there and things, but sometimes it's not like you can ring 999, right? And just like someone's going to come to your aid. So sometimes it's good for you to know and understand it better to keep you calm. And even if you can just do something very, very simple at the beginning, I don't think you realise the impact you have when you bring them to the vet practice. If you've got someone that's kind of clipped and cleaned a wound, even if it's a case that, you know, I've got to see it because it's a bite wound, but they've just done that initial thing because maybe they haven't been able to get to me for an hour or something. I always think, great, you know, you've got really good common sense there just to say, let's try and prevent it getting any more contaminated. I've put this buster collar on so he can't scratch it or lick it anymore. It's just really, it's really useful to have that. Thank you, Debbie. So, and the kids love the vet school as well. So yeah, so if you've got children, I do a little vet school for kids on a Thursday morning at 10:30. It's more like a class, so it's very structured. Unlike this is a bit more free and easy. It's definitely like I'm in a classroom, get my teacher head on. Good, glad it's a good refresher for you. It's important to refresh your memory for sure. It is again. Yeah, no, Kelly, you're right. It's good. It's good to be prepared. Being prepared means you stay calm and you just make a really good pet owner or pet professional. The more you keep refreshing, I know people say to me, when I've done your course, how often do I need to do it? And I will say, well, 3 years is what your certificate's valid for, but actually, as many times as you can go over these things and just get it in your brain, when that animal that you're looking after suddenly drops down and has a fit, you are literally like bang, 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 because you just know it. So you need to refresh yourself as much as you can. Colette again, you're so lovely, Colette. I love your vet school. Oh, you're very welcome. You're very welcome, actually. It's children like you that get me doing things like that because it's nice, especially when you get that appreciation. Thank you, Rosie. Thanks, Sandy. You've all sent such lovely messages. I'm glad I wasn't sat here on my own tonight just talking to the camera, although it does give my partner a break because, as you know, I like to talk and I tend to chew his ears off. So it definitely gives him a bit of time out. So I will post, oh, you're welcome, Rachel. Oh, thanks, Jodie. So what I will do is in a couple of weeks I will repost when I'm going to host the next one of these. I'm going to try and I was going to try and do them every week, but next week, I think I said yesterday when I did oh, you're welcome, Chloe, when I did I just saw in there, will I be doing a Q&A sometime? Yeah, if you'd be interested in that, what I can do is just host a general hour where you can bring to me some general questions about anything. Happy to do that. But next week on the Friday, I've got quite a good seminar to do, which is mainly, it's been very much directed at dog groomers. This isn't me like selling it to you, it's just sort of telling you why I'm not going to come on next week and do one on Monday. I've got to get prepared for this, and this is raising money for the NHS. It's the whole thing is basically about raising money for PPE for the NHS. So obviously I want to get that right and looking really great so that people really enjoy it, because, you know, I want to make sure that they raise lots of money. Yeah, thank you. You are all very, very flattering. Really lovely comments. As I say, I will post very soon and I will let you know when the next one's going to be on, and we're going to cover some other things. If there's things you want specifically covered, you can ping me a message. Happy to talk about anything, go over anything. And I will catch up with you hopefully in the next couple of weeks. And so if you have got kids, bring them along on Thursday. It's good to get them learning young, right? I think that's what we need to do. The more they know, the better pet owners they become. So love you all very much, and thank you very much for your time this evening and for tuning in. I'll speak to you soon. Bye guys. Lots of love.